Mr. Chairman and members of the subcommittee, my name is Elizabeth Mack. I'm a pediatric critical care physician and president of the South Carolina chapter of the American Academy of Pediatrics. I'm here in opposition to H 4624. And there's a lot of misconception about gender affirming care, so I really wanted to do a little myth busting here today. Number one, there is no gender confirmation surgery occurring here in minors in South Carolina. None. So it's not of concern, and you can take it off your list of things to be worried about with our youth. There are lots of things of concern in general with our youth. That's not one. Number two, gender affirming care, as Dr. Greenhouse said, occurs with the intense involvement of parents. Minors are not making these decisions solo. And a quote from the AAP guidelines, even when in states where minors may access care without parental consent for mental health services, contraception, STIs, parental or guardian consent is required for hormonal care of patients who identify as trans. Another concern to take off the list. Number three, half of trans kids consider suicide and a third attempt suicide because of bullying such as this and forced outing. And I see these children in the ICU. I've pronounced several dead. And we are seeing more suicidal ideation and attempts since the budget proviso passed in July 2022, disallowing care in the Low Country. And we don't have those data as many parents request and mention in the record, understandably. Number four, mental health assessment and counseling is a prerequisite of the care in children with gender dysphoria, both in practice and according to the guidelines, and this would be made illegal in this bill. To be clear, there's no such thing as a child coming in after watching a video on social media saying, I think I'm trans, and then we start them on meds. That just doesn't happen and can be taken off the list of concerns. Number five, gender affirming care is not fringe care. It's evidence-based standard of care because it is suicide prevention care with strict guidelines intimately involving parents and caregivers. And if it becomes illegal, our trainees will need to learn this care elsewhere, and we will be at risk of malpractice.
Representative Catalino.
Hey, how are you?
Hi.
Is it true that the FDA has not approved puberty blockers to actually be used for gender dysphoria?
So most medications, let me just start with saying, most medications used in children do not have a label for their use. Like if I only used medicines that were on label in the ICU, I wouldn't really have any options to use. So that's not really like a comparator in pediatric medicine. And the reason for that is because there aren't a lot of studies in children because we always start with adults first. But to get to the point, they're certainly safe, and we use them actually for a variety of indications. So endometriosis, actually in adults, various cancers, but in children, PCOS. Precocious puberty is actually probably the most common indication. Though we don't use them at this age in gender affirming care, we can use these medicines very young in kids without concerns. And yeah, so it's a very commonly used medication, or that group of medication is very commonly used.
But it is not, correct?
What's that?
It is not FDA approved for that use though, right?
I believe that it actually is. Somebody could correct me on that. My pediatrician friend, I can check.
Okay. Follow-up question on that. Is there a warning label on puberty blockers from the FDA that actually states that it increases suicidal thoughts?
No. The black box warning was related to pseudotumor cerebri, which I'm happy to explain what that is because we see it with a lot of different medications. But no, the black box warning was related to pseudotumor.
Okay, thank you.
And that was from April of 2022.